Moving on, I'll ask with two Nicoles. So Nicole Lurie. Nicole, do you want to go first? And same challenge for you. What do you feel you heard about? What would be your opening remarks for this?
I think great comments from PD, and I think we just covered so much ground today. So I might end up reiterating some of this, but I would also just say in response to her comment, I'm one of those people who has no interest in getting a diagnostic test. If I'm sick, I'm going to stay home. I'm not going to do anything different with the result of the test. And I have a fear that we don't yet have the right balance between getting people to use testing and use testing appropriately and overusing it to the point that we're driving ourselves into terrible shortage situations. And we have this phenomenon when stuff is scarce, whether it's vaccines or diagnostics or therapeutics, people really want it. But let's think about the people who really need it or are going to do something different with the result. It could be going back to work. It could be visiting a grandparent, or it could be relieving anxiety. But these people who are serially testing every day, we have some education to do there. So, I guess I heard a couple of things, and I think as Preeti said and Rick Bright said, never let a good crisis go to waste. So this is the time that we all ought to be envisioning the kind of system we want on the other side of this. Frankly, we should have started envisioning that 2 years ago. I think some people did, but there is a lot of work to do. And as I said before, any good crisis response is built on the back of strong day-to-day systems. And this is a good opportunity for us to look at our day-to-day systems that were really rickety and figure out what we're going to do about them. And the systems that support equity, particularly, I would say outside of the healthcare system and, social circles and our social safety net, really, really, really important to think about how rickety that is. I also think I learned from many of my former lives that you never want to have a single point of failure. And I think, what I heard a little bit repeatedly, yes, we had a number of points of failure, but almost all of them could have been anticipated in one way or another, whether it was the CDC test not working and challenges with getting other people to be able to develop tests, not being able to authorize them, not being able to have supply chains, et cetera. So really sort of thinking through where are all the points of failure and planning for them so they don't happen is really, I think, also critical. As I put on my global hat for a minute, one of the things I've been struck with through this whole COVID pandemic, and it was reflected in a couple of comments in the chat, is that, the global system is not put together like the US system. And for as challenging as the US system is, at least the federal government is responsible for, surveillance, diagnostics, countermeasure development, procurement, distribution, et cetera. In the global system, it's nobody's responsibility. It's nobody's responsibility it hadn't been anybody's responsibility to curate all of the gene sequences that got posted. And thankfully, GISAID really stood up and has become that system. It is financed, somebody asked, from a variety of sources. But one of the things it does that other systems don't necessarily do is it gives the contributors some sort of recognition and academic credit for posting what they do. And that's been a huge motivator and has really stimulated a lot of global collaboration. It's no one's responsibility to collect virus specimens and grow them up and share them with the world. It's nobody's responsibility to collect serum or human specimens and curate panels so that diagnostic test developers could move forward. And I heard the person from OraSure, it was because the federal government realized that it was nobody's responsibility to do that. So in my mind, excellence means a end-to-end system where it's clear who has responsibility for what. You don't have any single points of failure. And that all of the systems we talked about, social media, big data, development, all of those things combine ultimately to support access and equity. I'll stop there.
Thank you so much, Nicole.